Hello everyone and welcome once again to Moorgate Andrology. I'm David Mills and I'm here today to introduce a new video which we've thought about doing for ages. You know, we get asked a lot of questions about all aspects of genital surgery for men, and we thought it'd be a good idea to put it all together in one video. You don't have to sit through the whole hour if you don't want, and maybe just pick out the section that's relevant for you. We hope you enjoy it, and please give us some feedback below if you do. Thanks a lot. You know, I've worked in cosmetic surgery now for 37 years, and I'm sure during all that time, penis size has mattered to men. But it does seem that in recent years, certainly more and more men are having cosmetic surgery, we know that. But we are seeing a significant increase in the number of men interested in penile surgery. Our urologists are seeing it, not only in the UK, but across Europe. It does seem that more and more men are prepared to take that extra step and have surgery or non-surgical treatments to improve their penis size. You know, if you're thinking about having penis enlargement injections, penis enlargement surgery, or in fact any genital surgery, then it's understandable if you think you're the first guy ever to do this. Well, let me assure you that you're not. We are seeing more and more men every year coming forward for all types of genital surgery, but in particular penis enlargement. That is Moorgate's signature procedure. It's the one we're best known for. And more men are seeking out this treatment every year, and that trend looks set to continue. So if you're embarrassed or you're not confident about speaking to someone about it, don't worry, we understand all about that. But we have a team of urologists here that are here willing and to sit down with you and discuss all your concerns, all your fears maybe, and your hopes from these treatments. So do get in touch and make an appointment with a urologist if you have any concerns about penis size or any aspect of genital surgery or procedures. You know, at Moorgate, our most famous procedure, the one that is our signature procedure, is penis enlargement. Now, penis enlargement encompasses both surgical and non-surgical options to increase the penis size. Well, certainly at Moorgate, if you're looking to lengthen the penis, then you will be looking at a surgical procedure. If you're looking to increase the girth of your penis, to making it thicker, then there are surgical options, including a fat transfer procedure, and also a non-surgical option where we use hyaluronic acid to thicken it temporarily. So when it comes to penis enlargement, you have got some choices. So if you're considering penis enlargement, then it's really important that you get the advice of a professional. And this usually means a visit to a urologist. They are qualified and experienced in penis enlargement procedures, including surgical and non-surgical options. You know, over the years, I have seen a number of guys who have tried to do this themselves. They've tried to enlarge the penis by injecting all sorts of stuff into the shaft of their penis, and they've caused an awful lot of damage. So don't even think about doing that. If you're thinking about penis enlargement, get the right medical advice to begin with, because there's lots to consider, and only a medical professional can tell you not only the benefits of penis enlargement, but also the risks and the potential risks and complications. So when it comes to penis enlargement surgery, you have the option to increase both the length of the penis and the girth of the penis, or you could have just the lengthening or the girth. Now at Moorgate Andrology, most patients we see, about 70–80% of patients, will have the length and girth surgery done together. But if you want one or the other, that's fine too. The lengthening works on the principle that as men, we all have some hidden length, and the surgeon releases this hidden length to increase the flaccid length of your penis. It doesn't increase the erect length. That's something that we work on after the operation, but the surgical part is all about increasing flaccid length. And to increase the girth, this is a fat transfer procedure. Fat is taken from one area of the body, usually the stomach in guys, and we put that fat, after it's been put through a purification process, that fat is injected into the shaft of the penis to thicken it. And that thickening process increases both the flaccid and erect girth of the penis. Now, if you're considering having both the length and thickness of your penis performed surgically, this takes about 1 hour under general anaesthetic, that's all. Non-surgical thickening of the penis, well, this depends really on the amount of hyaluronic acid that's injected at the time. Most guys tend to go for between 10 and 15 mils of HA on their first treatment, and that can typically take around 1 hour or so to 2 hours depending. So if you're having just the length or just the girth performed, this does take a little less, maybe around 40 minutes to 45 minutes, but both together, just an hour. You know, one of the most common questions we get asked about penis enlargement is, does it last, the surgery aspect? Well, the lengthening part, yes, you should not need to have the lengthening done again because we'll use a silicone buffer to drop in between the pubic bone and the penis, which stops the penis retracting and pulling it back shorter again. So the lengthening you should not have to be repeated. In terms of the fat transfer, there will be an element of the fat that will always remain, but you should always consider that maybe at some time in the future, you may want the fat topped up, and a repeat girth procedure can be performed later on. Of course, after the first girth procedure, if you're wanting the penis even thicker, it is possible to have a second fat transfer after the first one. Not many guys do that. Most are quite happy after the first procedure, but it can be done if you're wanting extra girth gains. So let's discuss what happens after your penis enlargement surgery. Well, the first thing I need to mention is that you will not be able to have any sexual activity for between 4 and 6 weeks. Your urologist will tell you specifically, but normally it's a period of 4 to 6 weeks. You may also need to take some time off work. Depending on the type of work you do, you need to take a few days at least off work just to recover. Also, if you go to the gym, you may need to ease off gym for, again, about 4 weeks. You may be able to do some upper body work after 2 weeks, but certainly lower body, again, about a month before you get back into that sort of regime. You know, having penis enlargement is all about increasing your self-confidence. You know, lots of guys come to Moorgate and they are lacking in self-confidence because of their penis size. It may be because they've had some bad reactions from partners, or just because, you know, they're going to the gym and, you know, they can't help but measure up against their friends and they realize that their penis is smaller, and this impacts on their confidence terribly. Now, if this is you, we understand, and this procedure is all about increasing that self-confidence and restoring your self-confidence. This is something that the urologist will discuss with you in your consultation. You know, some guys ask us, is it possible to achieve an orgasm after having penis enlargement surgery? And the answer our urologists always give is, if you could orgasm before having penis enlargement surgery, then you most certainly should be able to do after the surgery. You know, lots of guys come to us who are overweight, and this is impacting not only on their confidence, but they believe it also contributes to their penis looking small. Now, it doesn't mean to say that being overweight, you cannot have penis enlargement surgery, because subject to the various medical investigations we have to do before you have any type of surgery, if they are okay, then you can have penis enlargement surgery if you are overweight. The one thing I would mention is this: if you have extra fat on your stomach, and in particularly in the suprapubic region below your tummy, then this can make the penis look a little bit buried. So losing weight on your tummy Losing weight, particularly in the suprapubic region, can help your penis look bigger without even having any surgery at all. So where you can, do lose weight, because things will look better before we do anything else. You know, it's only in recent years that penis enlargement injections have become really popular in the United Kingdom. The surgery came first, penis lengthening surgery and penis girth surgery. But as time moved on, doctors began to realize that hyaluronic acid, which is usually used to fill in wrinkles in the face and plump up lips, could be used successfully to thicken the penis. And hyaluronic acid injections can thicken the penis in the same way that transplanting fat can. But the difference is, with hyaluronic acid, this is a more temporary treatment. So the penis will be thickened, depending on the product, for about 12 to 18 months. And then after that time, you will need a little top-up treatment to bring the penis back to what it was on the day that you had the treatment done. Now, our preferred choice for thickening the penis with hyaluronic acid is Voluma. This is a deep tissue filler that's usually used for augmenting the cheeks. If you've lost weight in the face, it does a great job of plumping out the cheek area. This particular filler is very successful in increasing the girth of the penis. Results tend to last about 12 to 18 months before you need a top-up treatment. Now, with hyaluronic acid injections, the treatment does have to be repeated. So this is only a temporary solution. But you know, lots of guys like that because they don't mind picking up the phone after 18 months, making an appointment, coming in, getting the penis topped up with filler, and then going home again. Now, hyaluronic acid is not the only option in terms of fillers to thicken the penis. There are others out there, such as collagen stimulating treatments, and some of these last longer than hyaluronic acid. So if you're considering a filler to thicken your penis, then it's a good idea to make an appointment to come and see a Moorgate andrology doctor, so we can discuss these options with you and we can find which particular filler is the best option for you. So the collagen stimulating treatment for penis enlargement by injection is composed of polycarpolactone. This is a clinically proven treatment which gives a longer lasting option in terms of penis enlargement. But collagen stimulating treatments is not for everyone, and you should discuss it alongside the other option, which is hyaluronic acid. And our urology doctor will do that when you come for consultation. You know, one of the first questions we're always asked when it comes to penis enlargement injections is, will it increase penis size, flaccid and erect? Well, let's be clear to begin with that penis enlargement injections are not really for lengthening of the penis. It's often said by our urologists, though, that the weight of the filler on the penis can pull down the penis slightly and make it look a little bit longer, but it's not a lengthening procedure. But what it does do is it does increase both the flaccid and erect girth, the thickness of the penis. Now, the time between each top-up treatment of your penis enlargement injections will depend to some extent on the type of filler that is used and also how quickly your body breaks the filler down. But typically, for example, with the Voluma treatment, it typically lasts between 12 to 18 months. Most guys come back after a year and have a top-up treatment done. And typically, this is about half the amount that they had in the first treatment to put the penis back to the girth gain that they got when they had the treatment first done. But remember though, in your particular case, the longevity of your treatment could be a little longer or a little less, but typically expect about a year before you need a top-up treatment done. Now you might be thinking, well, what girth gains can I expect from penis enlargement injections? Well, this depends on a couple of factors really. Firstly, the amount of filler that's injected at any particular time. In most cases, our urologists tend to inject on the first treatment between 10 and 15 mils of filler. And the next thing to take into consideration is the length of the shaft to begin with. So if you have quite good length of shaft, or penile shaft, then it will take a little bit more filler to get you to a good position. Whereas if the penis is very short, then obviously the same amount of filler will make the penis look quite a bit thicker. So you should discuss with the urologist how much filler to have in a particular treatment, depending on the length of your penile shaft, and also your expectations from the treatment. One thing we should mention, of course, is that the great thing about penis enlargement injections is that you can always come back later and have more filler to increase the girth even further if you wish. Now, if you're using penis pumps or penis traction devices, then you can use these after the enlargement injections. So if you're happy to have the penis enlargement injections to increase girth, you can still work on increasing the length of your penis with the traction or pump devices. However, the urologist may want you to wait 2 to 4 weeks to let the filler settle down before you start using the device again. And the reason for that is that in the first week or two, the filler can migrate a little bit, and you will have some massage to do to get the product nice and even up along the shaft. So ask your urologist when you can start using your device again after the injections, but there's no problem. When things have settled down, you can continue using that device. Now, when you've had penis enlargement injections, it's quite normal to see, or even if you don't see, you can feel the odd tiny lump underneath the skin. Now, since we began doing these injections with cannulas rather than needles, the result immediately after the injections is much better because the penis looks much more symmetrical and less lumpy. But nonetheless, you still might feel or see the odd tiny lump. So what you have to do is with your finger and thumb, just massage these little lumps out, and you'll find that these will settle down usually very easily over the following few days. And that's why you cannot have sex for 4 weeks after penis enlargement injections. You know, some clinics are still advocating that you can have sex after a matter of days, but it's best to wait because there's always a risk that if you have sex too soon, you can cause this filler to migrate to the base of the penis, and then it's more difficult to get everything back to a nice symmetrical look. So massage is very important. The urologist will show you how to do this before you leave the clinic, and you should continue to do this for about 1 or 2 weeks. So if you're considering penis enlargement injections, then, albeit a non-surgical treatment, the urologist is still going to want to know that you're fit and well enough to have the treatment. So when you come for your consultation, the doctor will take a full medical history and take into account any medical conditions you have, such as high blood pressure, diabetes, or indeed anything else. And also, he or she will want to know what medication you're taking. So this is really important to make sure that as far as we can possibly know, all the potential risks and complications of treatment is mitigated as far as possible. You know, the most important thing when you come for penis enlargement, whether it's surgical or non-surgical, is your health and safety. So as part of the consultation, the surgeon is going to want to know all about your medical history, any medical conditions you have, and any medication you're taking. And he may take advice from other specialists, such as anaesthetists, to make sure that you're fit and well enough for an anaesthetic. So you can rest assured that before you have any penis enlargement procedure, we make absolutely sure that you're fit and well enough and that all risks are mitigated before we do anything. You know, lots of guys come in and ask us about weight. Will losing weight increase my penis size? Well, if you are overweight, and let's say you have, a big belly, or you have fat on the suprapubic region, this is the fat in the pubic area below your stomach, this can make the penis look small because this extra fat can sort of partially cover the view of the penis, and this can make your penis look actually smaller than it is. So if you're able to lose weight in these areas, then your penis can look bigger before doing any surgery or any injections. So if you can, try and lose a little bit of weight, and you might notice that things start to look a little bit better. Now we want to talk about some of the myths about penis size, and the first and obvious one to mention is the old wives' tale or myth, call it what you will, that if a man has big feet, then he must have a big penis. Well, we can tell you this is certainly a myth. There are lots of guys out there, I'm sure, who have big feet and also have a bigger than average size penis, but it has no relation to their shoe size whatsoever. You know, of all patients that come to Moorgate for penis enlargement, nearly all have the girth aspect increased because most men realise that for their partners, the girth is the most important part when it comes to sexual intercourse. So if the penis is very narrow in terms of its girth, particularly when erect, then that could impact potentially on sexual performance. So most men that come for penis enlargement will choose to have a girth increase. You know, we see lots of guys who are using penis pumps and they ask us, do they work? And I think the reason they ask us, do they work, is because they've probably tried them for a week, a month, and then given up because they don't see results. So pumps and traction devices can work, and indeed there is scientific evidence to support that they do, but you have to use them over the long term, at least 12 months before you start to see meaningful results. Penis pumps are very good at improving erection quality, and traction devices can be very good at increasing some length to the penis. But again, you have to be consistent in their use. You have to use them every day and increasing the amount of time that you use them too. So they can work, and they do work, and they certainly have a role to play. After penis enlargement surgery, for example, there is a traction device that our urologists ask patients to use to help improve erect length of the penis after the surgery and to help keep the penis stretched just after the ligamentosis part of the penis enlargement operation. If there is a disadvantage in terms of using a penis pump or traction device, it's perhaps the fact that you have to use them for quite a long time in most cases before you see appreciable results. I mean, at Moorgate Andrology, we see lots of guys who have tried penis pumps and traction devices, but they've given up, usually after a period of weeks where they've used them consistently but have not yet seen results. So if there's one disadvantage, it's the fact that you have to really be dedicated and use them for a long time before results start to show. So around 2 years ago, we developed something called the Mills scale, which is a range of penis length and penis girth sizes by which we could measure what women really wanted, because this is a question that lots of guys ask us. Well, we know what we want as men, but what do women want? The results of our research was really interesting. We did a study in the north of England on 180 women, and we asked them the question, well, what penis size do you really want? We know that the UK average length of an erect penis is 5.16 inches. But the question was, what size do you really want? And I can tell you that 91% of women in that study wanted over 6.5 inches in length when erect. So there you are. So the average size, 5.16 inches, and the size that women tell us they really want is over 6.5 inches in length when erect. You know, we get lots of inquiries from men who have a condition called micropenis. Some know they have this condition and others don't. And they say, well, do I have a micropenis? Well, the key statistic in all this is it is classed as a micropenis if the erect length of the penis is less than 2.8 inches. This is measured from the very base of the penis to the tip. Now, if you have micropenis, this can be a very debilitating and embarrassing condition, and one which is treatable with penis enlargement surgery in most cases. If you have a condition of micropenis, then you really need to arrange an appointment with a urologist to get some sound advice and to consider the steps forward in terms of increasing your penis size. The causes of micropenis include hormonal issues where the penis just doesn't grow from puberty, and this can be really debilitating and very embarrassing for young men. If you have this condition, it is something you can discuss with your general practitioner, or you can make an appointment to see a urologist to see if surgery is an option to increase your penis size. If you have a micropenis, it doesn't mean to say that you can't father children. We get asked that a lot. So everything functions just normally, it's just that the penis is very small. So if you're concerned about aspects of fertility, or indeed you want to do something about a micropenis, then do get in touch and arrange an appointment with one of our urologists. We can take you through the procedure step by step. So erectile dysfunction is the inability to obtain or sustain an erection strong enough for sexual intercourse. So did you know it's not only elderly men who suffer from erectile dysfunction? Lots and lots of younger men suffer from ED, and this can be for a variety of reasons. Maybe they have certain illnesses which are affecting their erections, or they're taking medication which is affecting erections, and sometimes there's no real physical cause, but there could be certain psychological reasons that they are struggling with sustaining or obtaining an erection. Now, if you're suffering from erectile dysfunction for the first time, it's very important that you get the right professional advice, because in most cases, ED can be treated very successfully. So make an appointment to see your general practitioner, or you could make an appointment to see a urologist. Now, at Moorgate Andrology, we have a team of urologists who are very experienced in treating erectile dysfunction with various procedures. So if you're concerned, do give us a call and make an appointment today. So there are various approaches to treating erectile dysfunction, and these will be discussed with you together with our urologist. So treatment options include oral medication, injections, and even penile implants. Other procedures are also available, and other techniques, including counselling. If you're suffering from erectile dysfunction, then please don't suffer in silence. Get some help, because ED can be treated, and the results of treatment in many cases are very fast. Now, the surgical option for treating erectile dysfunction is a penile implant. And there are two types, usually a malleable implant or an inflatable implant. The malleable implant is an implant which, when you want an erection, you bend the penis up and then bend the penis down again when you don't want an erection. Perhaps the best known disadvantage of the malleable implant is that the penis is really always in an erect position. It's just either bent up or bent down. So it doesn't give the most natural look to the penis in the flaccid state. But nonetheless, it is very easy to use. The inflatable implant, on the other hand, is completely hidden in the male genitalia, and it gives the most natural look to the penis when the penis is flaccid. And you simply pump up the implant from a device located in the scrotum when you want an erection, and then when you're finished, you squeeze a valve and it releases the penis from the erection and puts the penis back into a natural state. So penile implants are not visible because the implants are put into the shaft itself. However, the most natural looking implant is certainly the inflatable implant, because the other option, the malleable implant, the penis always looks in an erect state. It's either bent up when you have sex or it's bent down when you don't. But there's no visible parts to either implant. Now, implants are medical devices. They are there to last a long time, but as any other medical device, it may need to be replaced over time. You know, one of the great things about penile implants is that it can keep men sexually active well into their old age. So usually, lots of men choose an implant when other methods of treating their ED have stopped working. So for example, they may have been using medication or injections, and then these medications stop working. But a penile implant is a mechanical device that triggers an erection when you want one and can keep you sexually active for a long time. So if you're considering a penile implant, whether it's a malleable implant or an inflatable implant, then arrange an appointment with a urologist and come in and get all the facts and the information you need to hopefully keep your sex life on track. So it doesn't necessarily mean you have to have surgery to treat erectile dysfunction. In fact, the first line of attack in treating erectile dysfunction is usually oral medication. And there are a choice of these medications out there that can successfully treat ED. Where oral medication hasn't worked, there are also injections available which you use yourself at home. You self-inject these just before sex to initiate an erection. There are also various devices such as penile pumps which you can consider that encourage blood flow to the penis, which is obviously a very important component of generating an erection strong enough for sexual intercourse. So if you have to have your prostate removed due to prostate cancer, this does lead to erectile dysfunction. And usually most men consider penile implants after prostatectomy. If you're due to undergo a prostatectomy, then it's important that you discuss with your urologist how you're going to deal with your inevitable erectile dysfunction post-surgery. Thankfully, there are devices such as penile implants available which can successfully get your sex life back on track after having your prostate removed. You know, lifestyle plays a very important factor in terms of your fertility rate and also your erections. So for example, smoking, obesity, excessive intake of alcohol can all have an impact on both fertility and the quality of your erections. If you have issues with any of these factors, then please discuss these with your GP or make an appointment to see a urologist. All these conditions are treatable and can improve both your fertility and the quality of your erections. You know, we're often asked if masturbation can affect the fertility rate. Well, the answer is no, but excessive masturbation can reduce the quality and quantity of the sperm rate. So frequent masturbation will not reduce the fertility rate, but excessive masturbation can reduce the sperm count. So, do you suffer from a bent penis? If you do, we're going to tell you all about a condition called Peyronie's disease. So, Peyronie's disease is a curvature of the penis, which is visible when the penis is erect. It's caused by the formation of scar tissue, usually because of an injury or trauma to the penis. If Peyronie's is left untreated, it can lead to a very debilitating condition where the bend in the penis makes it very difficult or sometimes impossible to achieve penetration. So there are a number of surgical options for treating Peyronie's disease, including the Nesbitt procedure and the so-called stage technique. If you're considering a surgical option for Peyronie's disease, then it's really important that you arrange a consultation with a urologist and the different surgical options can be discussed with you. All are very successful in straightening the penis. However, some procedures, such as the Nesbitt procedure, can leave the penis shorter than before. There are some procedures, such as the stage technique, that can help protect your existing penis size. Another option for treating Peyronie's disease are injections. If the curvature of your penis is not much greater than around 30 degrees, then there are some non-surgical injections that can be performed to help improve the plaque which is causing the curvature. Now, it might be that the penis won't be perfectly straight after the injections, but the idea behind the treatment is to get the penis straight enough that you can enjoy sexual intercourse with your partner without any discomfort for either of you. You know, testicle replacement surgery is really common, and it's usually performed as a result of either a trauma or indeed some disease where the testicle has had to be removed. Thankfully, we can use implants to replace a lost testicle that are very similar to the remaining one. And the testicles also are available in different sizes, so they can be matched up very, very well. A frenuloplasty is a surgical procedure to release a very tight frenulum. If you have a tight frenulum, this can affect your erections and be very uncomfortable and a little bit debilitating. If you have problems with your frenulum, then you should make an appointment to see a urologist and discuss a surgical procedure called a frenuloplasty. This is a procedure which only takes around half an hour and can be performed under a local or a general anaesthetic. In most cases, the procedure is performed by a qualified urologist. So a circumcision is a minor surgical procedure to remove the foreskin of the penis. At Moorgate Andrology, we only offer male adult circumcision, and this is usually performed because either men have a condition known as phimosis, where the foreskin becomes extremely tight, that it's very painful or sometimes impossible to pull the foreskin over the head of the penis. And sometimes it's because men just prefer the way their penis looks without a foreskin. Either way, it can be performed. It's a procedure performed by a urologist here at Moorgate Andrology, and the recovery is fairly quick too. So if you're interested in adult circumcision, then please do get in touch with us and we'll arrange an appointment with one of our urologists. So stress urinary incontinence is an ability to control leakage of urine from the bladder. Stress urinary incontinence is extremely common and affects men of all ages. If you feel you're suffering from stress urinary incontinence, then it's important to seek medical help because procedures are available to help correct this condition. They're performed by urologists in most cases, and we offer consultations for stress urinary incontinence at Moorgate. One of the causes of stress urinary incontinence is following prostatectomy, which is removal of the prostate. Together with erectile dysfunction, you may also encounter stress urinary incontinence. So if you're suffering from stress urinary incontinence, there are procedures that can help you overcome this condition. The most important thing is to seek medical help. So make an appointment to see your GP, or you could make an appointment to see a urologist at Moorgate. Urologists have experience in treating all aspects of stress urinary incontinence with a choice of procedures available depending on your requirements. Lots of men suffer from excess pubic fat due to being overweight. And so being overweight can cause not only excess fat on the tummy, but also in the pubic region. And this can make the penis look a little bit shorter because in many cases this extra pubic fat covers partially the penis. A pubic lift procedure is an operation to remove excess fat and skin from the pubic area. This can be a very successful procedure and can also help in making the penis look longer, because if this extra pubic fat and skin is covering part of the penis, it can make the penis look smaller than it actually is. Now at Moorgate, we understand that cost is a major consideration when you're looking at having any type of penis enlargement surgery or injections, or indeed any male genital surgery. And it's quite tempting sometimes to simply opt for the cheapest price. Now, the cheapest price, it doesn't always mean that you're going to get the best medical care and the best outcome for your procedure. So our advice will be, look for value. You want good value when you have a procedure, but that means taking into account all aspects. Aspects such as the experience and qualifications of your surgeon, the location of your operation. Is it being done in a Care Quality Commission registered hospital? And also, don't forget the aftercare. This is a very important part of the procedure. Is anyone going to be on hand if you have any post-operative questions, or if you experience any complications after your surgery? All these things are really important. So take into account all these aspects when you're looking at the cost of your procedure. But by all means, ask the clinic what's included when you go along for a consultation. Make sure that you know exactly what you're paying for, and then you can make an informed decision about the cost. In recent years, lots of patients have chosen to go abroad for their cosmetic surgery, not just penis enlargement surgery, but all aspects of cosmetic procedures. And there's no doubt that very good care and very good services are available outside the UK. But perhaps the major consideration is that when you come back to the UK, you're going to need to make sure that you've got good aftercare and support. And critically, if there are any post-operative complications, you need to be sure that you have adequate provision for taking care of those. What happens in most cases is that patients who come back from having surgery abroad, they usually go to the NHS to solve these complications because they don't particularly want to go back to the host country where they had the surgery. Or in some cases, they simply don't have the time or the money to do so. So I think that's the major consideration if you're considering having a cosmetic surgery procedure abroad, is think about what happens when you get back into the UK. So if you'd like to get in touch with us here at Moorgate Andrology, there are a number of ways you can do so. You can call us on the number, we're popping on the screen for you now, or you can contact us by email. This is also on the screen for you now. If telephone and email don't suit you, then by all means go to our website and fill in one of the contact forms, and one of our patient coordinators will give you a call to give you a little bit more information. When you come to Moorgate Andrology, you can be assured that your privacy is respected at all times. We know how sensitive it is for you to come and talk about these procedures, and just to get to the clinic takes a lot. We know that, but you can rest assured your confidentiality and your privacy are respected at all times. So the first step in considering any type of genital surgery, whether it's penis enlargement surgery, penis enlargement injections, is a consultation. And that consultation at Moorgate is always with a urologist. This is a specialist in this type of surgery. We offer consultations at a number of centres across the UK where you can come along, meet the urologist and put all your questions to him or to her. The consultations take about half an hour, 45 minutes, and they're a one-to-one consultation. If you want to bring a partner, feel free to bring a partner along with you for a second opinion. So you know, the most important thing after the operation is taking care of you. And at Moorgate, we have our own patient care team, and their job is to keep in touch with you in between your appointments with the surgeon. So if you have any questions, anything you're not sure about, there's always someone on the end of the telephone. Of course, the important thing is that you attend your aftercare appointments with the urologist. These will be scheduled for you and generally last about 12 months, just to make sure that everything has settled down and everything is fine after your procedure. Of course, we have an ever open door. You're always welcome to call us, come back in and see us afterwards if you have any questions at all. We're always here on hand to help you. So you know, at Moorgate, we feel we are the very best choice for penis enlargement surgery. Why is that? Because we have a team of specialist urologists who are extremely talented and are delivering first-class results to patients with the very latest procedures available. Not only that, we have our own patient care team. It's not just about the operation, it's about taking care of you before and after the procedure. We're very lucky we have a team of anaesthetists as well and other medical professionals that are here to support the surgeon. So we feel we do offer a complete service. Also, if you're looking to finance your procedure, we can offer finance options so you can pay monthly for your operation or your non-surgical treatment too. So at Moorgate, it is a complete service. It all starts with a consultation. If you're interested in any aspect of male genital surgery, then please do get in touch. We're always happy to have a chat with you, and our advice on the telephone, of course, is always free.